Hi guys, the next skill we're going to go over is positioning the person in bed. Really, steps 1, 2, 3 are, again, when you get to those where it says the two identifiers, we want the students to be saying, to their patient, can you please state your name or date of birth, or however they choose to identify that patient. Maybe they'll say, well, if they had a bracelet on, I would check over that. Again, the equipment will be a folded flat sheet, and it'll be folded in half lengthwise and then folded over in half again. Um, Remember that every time it says hand hygiene within the skill that we are going to use hand sanitizer, we're telling them that one of the criteria for being able to use hand sanitizer is that your hands are not visibly soiled. Well, in our labs, their hands should never be visibly soiled, so they would not break that rule. Step 7, again, that asking a coworker, and when we are testing in the actual skills labs, we will randomly pick a student to be their coworker when we grab the sheet. Again, ideally, those students that have already tested, those are going to be your coworkers. Those first students that test, obviously, it'll just have to be whoever's, maybe it's someone that's talking that you need to get them out of there to, they're just being disruptive. Let's see. Also, remind them in our skills, we are not using the side rails at all. The videos, it shows that you can have discussion during your labs that side rails in certain facilities are considered a restraint and that we are not going to utilize them for our labs. And, they may come across them in the hospital or such of those institutions, but we are not going to test. It is easier to, those can become a crutch. And we want to teach them to think where the patient is positioned in bed before they move them. Those side wheels can prevent them from falling out, but then what happens when they don't have them? They haven't thought through the fact that, oh, if I'm going to move them away from me, I need to position them over towards me and then roll them away from me. On step 11, when it talks about remove the pillows as directed by the nurse, somehow we would like them to get that point, they would have to say something that, I would make sure it was okay that they didn't have an illness or an injury, that it was okay to take the pillow out. That's really critically thinking. If they're saying that versus just removing it, because not every patient we know can you safely remove the pillow. So to get points in 11, they would have to make some statement that they would have to check the care plan or check with the nurse or find out if it was safe to remove that pillow. On step 13, stood with their feet about 12 inches apart. One foot was in front of the other with their knees flexed. That's a starred item. So, they're not going to say it. We're wanting them to do it. So we have to be paying attention when we're testing. This skill has 3 different components that we're checking. Method 1 is moving the person in segments. They don't need their partner at this time, but again, we're teaching them that always have that partner with you, so the partner is going to come with them in the beginning, and they won't need them for this first step. So method 1, they're just basically going to move down that patient and move in segments, just like it says, really nothing significant. Method 2 is where they will need that peer and that coworker. If we are testing them for both positioning them in bed and moving up in patient, they don't have to remove that. If we're going to test them for the same thing, they don't have to remove that draw sheet in between. It's there. Odds are when they're in the real world, that draw sheet's already going to be on the bed anyway. So if we're going to test them for these 2 skills at the same time, they don't have to remove that. They rolled it, the draw sheet close to the person, grasped the rolled draw sheet near the shoulders and the hips, and the coworker did the same. Supporting the head. If they have that draw sheet positioned correctly, you know, the head may be just supported, but again, maybe what that looks like is they identify that, oh, I would make sure that the patient could hold up their head. If not, I would have to support it. Or if you see them trying, if that mannequin's head's going back and they've reached up to support it, again, we want to see that they're paying attention, that that head needs to be supported. So somehow they're going to have to identify that. Let's see. Moving, and that was step 21. Moving over to step 22. Rocked back on the count of 3, moving the person towards you. Your coworker rocked back slightly. Again, we're not paying attention to the coworker because we're testing the student that's testing. The wrinkles, we want to see them getting the wrinkles out of that. That's how they'll get the points for that. Step 24, really nothing significant. Step 29, that has a lot of components. That has A, B, C, and D. In order to get that point, they are going to have to do it's kind of an all or nothing kind of thing. So we want to see them doing A, B, C, and D in order to get that. Same thing with step 30, we want to see them doing all of that. And the same thing with 31. Instructors, when you're facilitating, make sure you're showing them how to position all of those pillows. Make sure, because it doesn't explain that in here in the actual steps. It shows it in the video, but you may have to reinforce that when you're facilitating those peer practice labs. If you have any questions with any of these, reply in the discussion where I post this. The post procedure, the call light. Back up to the beginning when it talks about when providing privacy. They can either pull the curtain or they could ask the patient, do you want me to close the blinds or pull the shades? Now, either way, that gives us a support that they are thinking about that privacy of that patient. So they could pull it or they could ask the patient, and that is, they would get that point either way. Then going down to the post procedure, again, unscreening the patient. If they didn't pull the curtain and they just asked the patient, again, they can ask the patient if they want the blinds open, if they want the curtain closed. That is showing us that they're thinking about that unscreening of the patient, and that's like how they would model it in an actual patient's room. Completing the safety check, we're watching them, that call light, that all of those supplies within reach, making sure that the walker or whatever appliances or the wheelchairs, out of the way, the bed wheels are locked. All of that is, kind of that final overview of the room. When they get to reported and recorded observations, they should be telling you, and when you're facilitating these peer checkoffs, explain this stuff to them. We don't right now have a way for them to document what they did, but have a conversation. If you're testing them, it's okay to say, if they say, I would document, go ahead and ask them, what kind of things would you document in this situation? I know we've been told we can't talk during the labs or the checkoffs when we're testing them. It's okay to just ask them, what are the things that you would document? Because that's encouraging them to be critically thinking. So again, it is okay, even in state testing, if you ask them, what items would you document? That is giving us evidence that the critically thinking, that they didn't just, do the skill, that is giving us data to support that they would get that area on the paper. We want them to be thinking about those things, so that's okay. And it's different than what we've done, but it's okay. Quality of care. How did we provide comfort? Well, what if they said to the patient, what are the things that they would say to provide comfort? And again, facilitating lab instructors, have these conversations with your student. Um, how would you provide comfort? Would it be, can I get you anything else? Are you comfortable? Just the statement, are you comfortable? And then and doing those extra things gives us evidence that number 40 was met. Protects the person's rights. If they asked them about providing privacy, the rights and stuff were protected. If they provided a safe environment, that's how they've protected those rights. And if they've done those things, they're going to earn that. They didn't really say anything, but you saw them doing those things. Did they handle the person gently? If they did, if they paid attention to that neck, then they handled that person gently. Again, we aren't concerned if they go out of order, that's okay. They would still get the points for this actual step, but then on the key concepts, they may miss points back there, such as for safety, critical thinking, or prioritization. And then we would give a little brief description as to, maybe why it would be more convenient, or it would be more efficient, not convenient, that if they went in the order that the skill stated. Now, if a student challenges you and says, well, wouldn't it be okay to go this way? If it makes sense to the student and they can provide you a rationale as to why they chose that, great. They would get those points. No, nothing lost. Again, if you have any question, that kind of concludes positioning the person in bed. Please, I encourage you, respond, reply, hit reply, play around with that, respond, ask questions, and other instructors answer those questions. And let's get a great discussion going underneath these videos, because we can all learn from each other. Some people maybe have already tested on these already, and so they can let you know, yes, that worked well, or they can maybe give an example that a student did to where something I've talked about played out and it worked and everything went fine, or maybe an example of something that didn't go well and how you handled it. So if you have any questions, please respond or reply to this discussion under the video. Thank you and have a great day.